these two are going to represent the veins. This is the internal lining. Remember, the center is going to be the lumen. So we have this right here, which is going to be your epithelial lining, which is known as the endothelium. Okay? This is endothelium, and this right here is the connective tissue layer. So we have the endothelium layer and connective tissue layer. These two layers make up what you call the tunica intima. This layer right here, which separates the tunica intima from the tunica media, is termed the internal elastic membrane. Okay, so internal elastic membrane. This right here is going to represent the tunica media. This is your smooth muscle. So if I say to you, what is the layer right here? Your answer is tunica media. If I say to you, what is this made of? You say what? Smooth muscle. If I ask you, what is the name of this layer? It actually separates these two layers. This right here is termed the external elastic membrane. So external elastic membrane. This right here is going to be your tunica externa. If I ask you, what is the function of this? You say that it anchors the blood vessel to the surrounding body. Okay? So this is that anchoring. This is connective tissue. This right here is the blood vessel, vein. This right here is going to be a vein. This is an artery. These two layers right here are the same as you found in the artery. This is your endothelium. It's the epithelial lining. So the epithelial lining right here is termed endothelium. And the next layer out is going to be connective tissue. The company shouldn't have done this. They put a little layer right here. Okay? This is representing what should be the tunica intima. There is no tunica intima in a vein. Does everybody understand that? So this right here should not be there. I will never put anything on there on this vein because it doesn't exist. This right here is going to be the tunica media. Oh, it brings up something else. Just a side note, probably every single model here in 132 has at least one thing wrong with it, one thing incorrect. So as we go through it, I'll usually point out what that is. If I don't point it out, it's usually because I didn't think it was necessary for you to even worry about. Okay, but practically everything in 132 has at least one model that has one thing wrong with it. This again is going to be the tunica media. And then the outer layer is going to represent the tunica externa. This right here is just representing a valve that is closed, and this is representing a valve that is open. No, I will not ask you if it is an open valve or a closed valve. All I care about is that it is a valve, and you should understand what valves are used for. Remember, they prevent backflow. Okay? I could also ask you what is actually causing blood flow to move throughout your body. In terms of veins, you would say what? Skeletal muscle contractions. Everybody agree with that? Okay. So that takes care of that. The back side of this is showing the same thing. It's just showing valves open, valves closed. Okay, basically that's it. Showing how the muscle contracts around it. Okay. Now we have more of these models up there in the yellow cabinet if you feel like you need to look at that. In terms of, could you hand me a stick? Thank you. In terms of the heart, now you have to go through this yourself, the other parts of the heart that I already went through on here. Okay, all you need is to translate it. Okay, I've said this before, I'll say it again. You're going to have patients, for most of you, you're going to medicine. You're going to have patients of different sizes, different everything. Okay, the overall parts are going to be the same though, so I want you to be able to identify it on one heart versus another. It's all the same. Okay, they all are the same. You don't need to have the same colors to do it. Okay, now I'm going to go over extensions of this. Okay. This right here, just to make sure we're clear, this is the right brachiocephalic vein. This is the left brachiocephalic vein. This right here is the arch of the aorta. Everybody agree with that? Mm-hmm. The first branch of the arch of the aorta is the brachiocephalic trunk. This right here is going to be the left common carotid, and this right here is going to be the left subclavian. As we move over to this one, blood flow right here, just to give you an idea, this right here is going to be the superior vena cava. This right here is going to be the ascending aorta. Ascending aorta, arch of aorta, and then the descending thoracic aorta. Does everybody understand that? So this is the ascending aorta, arch of aorta, descending thoracic aorta. The first branch off of the arch of the aorta is this branch right here that comes to here. That is the brachiocephalic trunk. Remember, we found that here and here, brachiocephalic trunk. The next branch is going to be the left common carotid, and the next branch as we move around is going to be the subclavian. So here again is the subclavian artery. Okay? So we have arch of aorta, brachiocephalic trunk, left common carotid, and left subclavian. Okay? Now, we are going to deliver blood to the brain and then have it return from the brain back into the right atrium. And that is the path we're going to take right now. So as the brachiocephalic trunk comes off on the right side, it's going to give off, remember, the subclavian. Why do we call it subclavian? Because it's below the what? Clavicle. Okay, subclavian is representing below the clavicle. So you can see that this arch is below the clavicle. clavicle will be right here. Okay? The first branch it gives off is going to be the right common carotid. The right common carotid, it also gives off this artery right here. That reminds me, I gotta go grab something in the back. This right here. Okay? That is the vertebral. Give me just 20 seconds. I need to run to the back and grab something. What is the name of this blood vessel that you see right here? Everybody remember this from 131? Remember this blood vessel right here? It was on some people's lab test last time in 131. For those of you who didn't have me for 131, consider yourself lucky. The 3 people are in here and now trying not to look at me. Okay? This right here is going to be the vertebral artery. Okay? Vertebral artery passes through the transverse foramen. Remember the transverse foramen in 131? Okay, went through the cervical. Those are going to be the vertebral artery. Then the vertebral artery passes through the foramen magnum. Okay, so then it passes through the foramen magnum, and you can see it come up like this. So this right here are going to be the vertebral arteries, and then they come together right here to form the basilar artery. Okay? I understand, but okay, basilar. Yep, we're going to get to that in a second. It's a little further up than I would like. We'll get into that in a minute. So this again is going to be the right common carotid. This is going to be the left common carotid. The next branch off, again, is going to be the vertebral artery. We also have a vertebral vein. You don't see the vertebral vein on this. You can only see the vertebral vein on this. Okay? The artery obviously is in red. The vein is in blue. As a reminder, the only time an artery is going to be blue is in where? Pulmonary. The only time a vein is going to be red is going to be what? Pulmonary. Same thing. Okay? So here we have the vertebral artery and the vertebral vein. The next is going, you know obviously where the vertebral artery is going to go. Vertebral artery is going to deliver oxygen to the brain. Okay, it's going to be one of the vessels that delivers oxygen to the brain. The next one is this one right here. It's labeled as, I would guess they would call that number 14. That is going to be the thyrocervical trunk. Okay, this right here is the thyrocervical trunk. Thyro indicates what? Thyroid. So what do you think is one part of the body that it supplies blood to? Thyroid gland. Good. And what do you think is the other part it supplies to? The cervical region. It supplies blood to the skin and to the muscles of the neck. Okay, to the cervical region. So that's the thyrocervical trunk. Does everybody get that? Okay, it's in red. So we're going to follow the common carotid artery up. And as the common carotid artery goes up, this is the common carotid. Okay, so this is the common carotid. The common carotid artery goes up. Here it is on the other side, the common carotid. Common carotid artery goes up, and it is going to split into 2. It's going to split into an external carotid and an internal carotid. Okay? The external carotid, how do we know it's the external? It's going to give off branches that are more superficial. Okay? So this right here is going to be the thyroid. Okay? This is going to be the thyroid artery. The next branch that goes around to the face, you can see it right here. You probably have even felt it in your life. If you feel around here, you'll feel a blood vessel. That's this right here. That's going to be the facial artery. That's an extension of your external carotid. Okay? So this right here is going to be the facial. The next one, which is deep inside, which is going to be really, really hard for me to test on, hint, hint, is going to be the maxillary. Okay? So that's the maxillary artery. Yeah, it's really hard for me to test on. The next artery that comes off of the external carotid is right here. That is going to be the superficial. And then what bone is right here?
Temporal.
Temporal. So what do we call this? Superficial temporal artery. What bone is back here? Occipital. Good. So what do we call this artery that goes back there? Occipital artery. See how easy that is? So these arteries of the external carotid are going to supply the muscles and the integument of the face. Okay, and of the head. Does everybody understand that? Okay. The internal carotid is going to continue its way up. You can even notice that you see this artery right here? Everybody see that? Okay. That's the vertebral artery. Okay? That's the vertebral artery going through the transverse foramen. There we go. So the internal carotid artery is going to go in. Where is the internal carotid artery going to supply blood to? The brain. So the 2 vessels that are bringing blood to the brain are the vertebral and the internal carotid artery. Good. Now, the brain. What constitutes the brain? This is the cerebrum. This right down here is the cerebellum. It sits like this in the skull. The vertebral arteries go through the transverse foramen, and then they eventually go through the, which my stick is under, is going to be this right here. And that is going to be the vertebral arteries. It's going through the foramen magnum. Everybody see that? Mm-hmm. It's going through the foramen magnum. Okay? The vertebral arteries come together to form this larger vessel right here at the base of the skull. This artery right here is going to be the basilar artery. This is the basilar artery. That's that artery I was talking about before. Okay, the basilar artery. Okay? Basilar artery. If you look at the vertebral arteries, if you turn the vertebral arteries upside down, you'll notice it looks like the letter V. What letter does vertebral begin with?
V.
V. You see that right there?
Mm-hmm.
See how it looks like the letter V?
Mm-hmm. Where?
My fingers are on it. Okay? See the letter V? Okay. The letter V comes together to form the basilar artery. As we go up, I'm now going to talk about the internal carotid artery, which is found on here and found on here. The internal carotid artery is this right here at the tip of my pointer. It comes up and splits into two arteries. The two arteries that it splits into are going to be known as the anterior cerebral and the middle cerebral. Remember, this, don't worry about it, just leave it. This right here is going to be the cerebrum, okay? Underneath is the cerebellum. So the blood is going to here, here, and here. The anterior cerebral artery is obviously going to supply blood to the frontal lobe. This right here is the anterior cerebral artery. It's one of the anterior cerebral arteries. You'll notice to your right is the second anterior cerebral artery. Thanks, John. Okay? There's an artery that connects the two anterior cerebrals. Anterior cerebral, anterior cerebral. The one that connects the two of them is going to be known as the anterior communicating artery. It allows for communication between the two anterior cerebrals. Okay? So this right here is going to be the anterior communicating. Okay? Right here. Okay? That's the anterior communicating artery. Now, this one right here, which is going to supply the temporal lobe and part of the parietal lobe, is going to be the middle cerebral artery. The middle cerebral artery. Okay? This is the middle cerebral artery. And in the posterior side, this one right here, where my stick is on, under, is going to be the posterior cerebral artery. What is that going to supply? Part of the parietal lobe, a little bit of the temporal lobe, but primarily the occipital lobe of the brain. Okay?
Are you going to ask us those things as well?
I might. Yeah. But in terms of location, I don't expect this to be too bad, because I don't expect you to have an answer like the posterior cerebral is going to supply the frontal lobe. I mean, if you say that, then there's, then I would definitely mark that wrong. But if I put middle cerebral and you say something like the temporal lobe, or you put down the parietal lobe, well, that's acceptable because the parietal lobe is a little bit supplied by the middle cerebral artery. Okay? Does everybody understand that? Mm-hmm. Okay. Now, this right here, we have, if you take a look, this right here is going to represent the middle cerebral artery, and this is the posterior cerebral artery. There's an artery that connects it. That artery that connects the middle cerebral with the posterior cerebral is known as the posterior communicating artery. There are, in fact, two posterior communicating arteries. It's connecting the posterior cerebral to the middle cerebral.